From easing nerve pain to helping with memory loss, there is very likely a supplement that claims big results, but are these safe?
As Good Morning Tennessee anchor Tirsa Smith explains, before you self-prescribe, there are interactions that could land you in medical trouble if you don't know the risks.
The dietary supplement industry is a $60 billion industry in the U.S. alone, and it's growing. For many, it's a source to improve their lifestyle.
So I got on a path to really learn about nutrition more. During COVID, when couldn't do much, I got on the computer and got certified in health and wellness.
Elizabeth Jones says she has had good results after researching which supplements and brands could benefit her.
Collagen is good for skin, bone, all those kinds of things. Also for hair regrowth. I was losing my hair a few years ago. Started taking this. Within a month, I saw some good results from that.
But buyers should beware. The supplement industry isn't held to the same standard as medications.
When you buy a supplement at a drugstore, at a supplement store, there is not the same type of regulation that you have when you buy an over-the-counter medicine. It is absolutely night and day.
University of Tennessee distinguished lecturer and registered dietitian Lee Murphy says supplements can be helpful for those who have nutrition gaps. She walked us through ways to make sure what you're buying stacks up.
If you are walking down the aisle and you heard this was a good supplement on social media or your friend or whomever, and you thought, I don't know where to start, having this seal is helpful. And so there's one called USP that stands for U.S. Pharmacopoeia that in particular is basically their third-party groups that go in and make sure that what is stated on the label is what's in the product that you're consuming. It basically gives the consumer a little added protection.
It's a concern Elizabeth says she's mindful of.
And I'm no expert in it. I just read and find what it says. I also have to sort out what companies, what's their end game. If they're smaller mom and pop kind of people and they have good reviews.
Summit Medical Group pharmacist Jesse Reed says social media posts on supplements are driving curious buyers to pharmacies.
With the birth of TikTok and, it used to just be Dr. Oz, right, out there promoting some of these products. But now we're getting different information streams.
Reed says before you stock up, it's important your doctor is aware of any supplements you're taking.
So they decided to supplement with something that was over the counter called ashwagandha. Very common. Lots of patients are currently taking it with success, but because they were on a medication already for depression, when they took it, there was an interaction that ended up having some musculoskeletal issues or musculoskeletal interactions.
And there are multiple examples of potentially harmful supplement and medication combinations.
The real answer is to find out exactly what you need. You would actually need to have blood work done with your provider.
A conversation that will keep you on the path to good health. You heard dietitian Lee Murphy talk about looking for those seals on supplements showing they have been tested by a third-party laboratory, enforcing their quality. Here's a look at some of those seals that you're going to be on the lookout for. Now, keep in mind, before you start stocking up on any supplement, consult your primary care doctor. Tirsa Smith, 6 on your side.
Now, 6 Sports.